is Greta Douglas. I am a community health facilitator with Facts Not Fear ICT project. We will be discussing substance use disorder. This community health session presentation is for informational purposes only and is not intended as promotional or medical advice. Always seek advice from your healthcare provider regarding any questions you may have about medical concerns, conditions, diagnosis, and treatment. What is substance use disorder? It is a chronic disease. It is no different than asthma or diabetes. It is a complex disorder. It affects a person's brain and their behavior. It leads to problems in all aspects of a person's life, including work, home, school, and with family. It can be treated. It is a medical condition for life. It can affect anyone. It is not biased based on race, your social economics, or finances. It can affect anyone. Substance use disorder can have a dual diagnosis, which is a substance use disorder diagnosis plus a mental illness diagnosis. Language and substance use. The words we use when talking about a person with a substance use disorder makes a difference. Words do matter. The use of these words create biases and stigmas. These old terms will include abuser, addict, alcoholic, degenerate, junkie, and user. The current terms are more person-centered terms. Persons with an alcohol use disorder, adolescents with an addiction, individuals with a cocaine use disorder, group engaged in risky use of substances, persons with a substance use disorder. There are stigmas when using those negative words, and there's a stigma with getting and seeking treatment. There are major barriers to treatment. Associated shame felt by individuals with substance use disorder and their friends and families can make it difficult for them to seek treatment. Why use new terminology? It respects the dignity of the person, it promotes recovery, helps affected individuals understand they are more than the disease. The causes of substance use disorder are not exactly known. There are many factors that contribute to substance use disorder. Possible causes of a substance use disorder will include social risk factors, biological risk factors, and psychological risk factors. The disorder can also include all of those. Social risk factors would include social support, relationships, and income. All of those things can be a positive or a negative, which means protective or a risk. Biological risk factors include your physical health, genetics, stage of brain development. Psychological risk factors include mental illness, coping skills, and your thoughts. Warning signs of substance use disorder. There are signs that can help you identify if someone might have a substance use disorder. This includes secretive behavior. They will become more secretive about what they're doing. You may not know their whereabouts for days on end sometimes. So those are included in your secretive behavior. Other warning signs would include social problems. Use causes problem at work, school, and home. Dedicate more time and energy to substances than other activities or interests. The need for the substance takes over every other aspect of their lives. Tolerance. The body adapts to continued presence of the drug. The person needs more of the substance for the same effect. They may begin initially using very little of the drug, but then will need more of the drug to get the same effect that they were getting initially from the small amount of the drug. Withdrawal will include irritability, changing moods, depression, anxiety, tiredness, inability to sleep, and cravings. Cravings are the need for the drug. Substance use disorder treatment can include detox, which is ridding your body of the substance, counseling, and counseling can include inpatient or outpatient, and sometimes can be a combination of both. It can also include medications that are administered by a doctor. Treatment considerations. What? The type of treatment needed. That will be very individualized by each person. When? The sooner, the better. The sooner you can get them into treatment and agree to treatment, the better. Where? Location of treatment. The location of treatment can be a factor for many people, especially if they have family and they need that family support to be close to them. If that treatment requires them to be, say, in a different location or a different town, that location may not work for them. So where becomes very important. How much? What is the cost? Will my insurance cover the cost? And if my insurance covers it, at what percentage? What portion would I then be responsible for paying? So the what, the when, the where, and how much are all factors in treatment considerations. Reasons to seek treatment will be your family, your job, financial, legal, and health. It can be one of those or all of them in combination. Signs of treatment progress. Having a good relationship with the counselor, getting comfortable, feeling like you can have those conversations, open and honest conversations with the counselor. Mental illness is being treated or absent. So having spoken about the dual diagnosis, the mental illness and the substance use disorder, when you have both in the dual diagnosis, when that mental illness is being treated and or absent, those are definite signs of progress. A strong support system, your peer support, your family support, whatever supports that you find that are very important, and rebuilding those relationships that may have been damaged during your substance use disorder. Employment, those individuals suffering from substance use disorder, those individuals may have in the past struggled to stay gainfully employed. So a sign of treatment progress would include them being able to maintain employment. Aftercare helps a person continue to make progress after completing addiction treatment programs. The goal of aftercare programs include relapse prevention, continuing to engage in recovery process, developing new and healthy behaviors, connecting with support systems, assistance with challenges related to recovery. Aftercare is just that. It is after you have received the treatment, those connections that you still maintain, and it is relapse prevention. Substance use disorder recovery. Characteristics of recovery, your physical health may change. You will see that those individuals, when before they may have been losing weight, not taking good care of themselves, not maintaining their hygiene, you will see that those things can and will improve. Other characteristics of recovery would be family and peer support. Those relationships that were previously damaged or fractured, you may see those coming back. You will see them maybe coming and attending more of the family events, being more present. Relapse. Relapse is not a sign of failure. It can happen even years after the addiction and recovery. Could be a sign that more or different treatment is needed. They may need to start over, and the last time they may have done outpatient, but maybe this time they may need to try inpatient. And inpatient does have more of a success in the recovery. How you can help. You can conduct an intervention, do not enable, and practice self-care. What is an intervention? An intervention is conducted with friends and family that provide examples of destructive behavior and their impact. Being very specific. If they missed your birthday last year, and that's something that you have done on a regular basis, meeting, that phone call, and they're not doing that, be very specific. If last Christmas they didn't show up for Christmas dinner, be specific. Describe how this impacts you. You missing my birthday was something that we have done for several years, and it hurt my feelings. It made me worry for you. Offer a prearranged plan. Outline clear next steps. How will this take place? Everyone that is present during that intervention all need to be on the same page. Outlining the clear next steps may include, we have contacted the facility XYZ. They are ready to accept you. They can take you today. Knowing that you have some steps and so a plan in place. During conduction of an intervention, when intervening with a person with a substance use disorder, speak without anger. Be non-judgmental. State specific example based on observation. Suggest that professional help. What you can expect from an intervention. You never know what you're going to get. Denial many times does happen. Again, be prepared with that plan. Offer that plan. They can become very defensive. They are not interested in getting help. They just may not be ready. I'll just quit on my own. And many times that is the reaction that you will receive. Knowing that, you're still going to make the offer of the facility XYZ being ready to accept you today. Willingness to try treatment. That is a win. That's a win for everyone. If during your intervention they are willing to seek treatment, go with that. That's a go. Do not enable. What is enabling? Things someone does to support a person with a substance use disorder that, in reality, supports the substance use disorder. Enabling can include letting a person live rent and responsibility free, allowing substances into the home, paying a person's expenses, giving the person money, paying for bail, fines, legal fees, not saying what you feel about the person's substance use disorder. Be honest. Let them know how their substance use disorder is affecting you, how it makes you feel. It can be difficult and painful to stop enabling. Remember why you are doing it. You want to help the person, not the substance use disorder. Practice self-care. Locate your support system. That may mean you finding some substance use disorder support groups within your community. Get professional help for you. If that includes therapy, do that. Do what works for you. Learn about substance use disorder. That could include, like I stated, attending some substance use disorder meetings, attend a support group. Practice patience. Be patient with yourself. Be patient with the individual. Tell your loved one when you are proud of their effort to treat their substance use disorder. Take those wins. Those things, anything that is positive is great. Encourage communication. Try to be open and honest with them. Listen to them. Be a good listener. Allow your loved ones to express their feelings without feeling judged. Express your feeling without placing guilt or blame. Find your calm. Find those things that bring you joy, those things that make you happy. If you're the type of individual who likes to work in the garden, have your hands in the dirt, do that. But find your calm. Get physically active. You might even get your family together as a group and do a weekly walk where we can just have discussions and interactions. Moving towards action. What is one thing you can do to help someone in your life or yourself regarding substance use disorder? Thank you for your time. Please visit Facts Not Fear ICT or scan our QR code for more of our pre-recorded community health sessions.